Hi, my name is Kaylee Tudor, and today I will be doing an informative speech over animal testing. Polio, smallpox, flu, malaria, rabies, HIV. In the past, any one of these diseases would have been a death sentence, but through medical advancements and research involving animals, individuals can now live normal lifespans after being infected or not have to fear infection at all. You may be thinking, how has animal testing benefited me? Many common drugs such as pain relievers, insulin, blood pressure medication, and mental health medications were all developed and tested using animals. To understand animal testing, you must first know the history behind it, the species involved, and the results of the trials. After first learning about animal testing in a veterinary science class, I have been fascinated by the impact it has on the medical field. I have furthered my knowledge of the topic through extensive research. First, I will discuss the history of animal testing. Secondly, I will discuss the species involved, and third, I will discuss the results of several important trials. The earliest documented case of animal testing dates all the way back to the ancient Greeks, such as Aristotle. He began researching vertebrate animals to study the basic anatomy. Greek physician Galen used animal experimentation to better understand anatomy, physiology, pathology, and pharmacology. Ibn Zur was the first physician to practice surgical procedures on animals before using human patients. In 1880, Louis Pasteur proved the germ theory that small organisms can cause diseases by administering anthrax to sheep. In 1922, through research with dogs, Frederick Batting and John McLeod developed a way to isolate insulin to treat diabetic patients. In 1950, Jonas Salk and his team created a vaccine for polio through research with monkeys and eradicated the disease. And this is just the tip of the iceberg. There are countless medical advancements made by animal testing. Currently, scientists are using animal experimentation to find cures for cancer, Alzheimer's, and spinal cord injuries. Now that we have learned about the history of animal testing, I will go on to discuss the species of animals used. Many different animals are used in specific areas of research. Mice and rats are by far the most common, making up 95% of all laboratory animals. Rats and mice have very short gestation periods, meaning they produce quickly. This makes them a very convenient test subject. They also have organ systems that are very similar to humans. This allows scientists to determine the effectiveness of tests and how they would work on the human body. Because of these reasons, they are used in a wide range of studies, from modeling diseases in humans to behavior and psychology. Rabbits are another commonly used research animal. Approximately 500,000 rabbits are used each year. Much like rats and mice, rabbits have short gestation periods and they're small in size. Another benefit to rabbits is their easily accessible blood collection sites. This includes the central ear artery and the marginal ear vein. Rabbits are typically used in chemotherapy, immunotherapy, and cholesterol research, along with eye disorders and toxicology. One research animal you may not expect is non-human primates. This includes gorillas, chimpanzees, and monkeys. Non-human primates are used in research because they are very similar to humans. Their brain, musculature, reproductive system, and immune systems are much like ours. This gives scientists more accurate and relevant results on how studies would affect the human body. However, because non-human primates are such a high-maintenance animal, they aren't as commonly used in research. When they are used in research, they are selected for neurological, reproduction, vision, and vaccine development research. Now that I have discussed some species involved in animal testing, I will discuss the results of several important trials. During its peak in 1940s and 1950s, approximately 35,000 people were diagnosed with polio each year. Polio is a devastating disease that affects the brain and spinal cord, which can result in paralysis, permanent disability, and death. In 1954, Jonas Salk developed the first inactivated vaccine after growing the virus in the kidney cells of monkeys. The vaccine was successful and used on 2 million children before it was switched over to an easier oral vaccine. Today, 99% of polio has been eradicated globally, with remaining cases in just Afghanistan and Pakistan. Smallpox was one of the worst pandemics in history. In the 18th century, 400,000 people died each year from the disease. Smallpox was a virus that caused a fever and severe skin rash. 3 of every 10 people that were infected with the virus died because of it. Of the survivors, many were left with severe scarring, especially on the face, and even blindness. It was discovered that smallpox was derived from a cattle virus called cowpox. After noticing that milkmaids who had recovered from cowpox didn't have any symptoms of smallpox, Edward Jenner developed the first vaccine for the virus. Jenner extracted material from a cowpox sore and injected it into a young boy. After exposing this boy to smallpox, and he remained healthy, this proved that the vaccine had worked. Scientists used Jenner's theory and developed it throughout the 19th and 20th centuries, eventually using calves to extract the cowpox material. Smallpox was officially eradicated in May of 1980. The smallpox vaccine was the first vaccine to contain live microbes. This set a principle for future cures to similar diseases such as measles and chickenpox. The HIV/AIDS epidemic began in 1880, and it was very fatal. Globally, 78 million people contracted the disease, and 39 million people died from it. HIV is a virus that attacks the immune system, and if not treated, can lead to AIDS. Through research using monkeys and mice, the first medication for HIV was developed in 1986. This drug increased the lifespan of people living with HIV. While conducting research on non-human primates, scientists gained a greater understanding of the virus and discovered a similar one called SHIV. This discovery led to the development of antiretroviral drugs, which allow HIV-positive patients to live normal, healthy lifespans. Recent research with mice and non-human primates has resulted in new preventative drug known as PrEP. It is a daily antiviral drug that decreases the risk of infection by 92%. Scientists are still working on developing a vaccine for HIV. However, recent studies with monkeys have offered scientists some hope that they are close to a cure. To fully understand animal testing, you must first know the history behind it, the species involved, and the results of several important trials. In conclusion, the medical advancements made through animal testing have saved millions of lives worldwide. Animal testing has helped to develop cures and vaccines for many diseases and will continue to aid scientists in their research for many years to come.